Hello, Dr. Molly Hart here with Pelvic Balance Physical Therapy. I hope that you all are having a wonderful Wednesday night. I just got done with treatment for the day and I just wanted to come on here and talk about what the heck vaginal self-care is. If you saw, I just released my TheHappyV program on Monday. I talked about it. I released it for sale. I'm going to be starting it in October. And I talk about vaginal self-care being the main thing that is healing for vaginal pain. So I've got a viewer on here. I just don't know who. Oh, it's Angela. Oh, Doracco, how are you? So anyways, point being, I want to go over what the heck is vaginal self-care, because that's a very strange word. What does that mean? It means a lot of different things that us women can do. Really, to be honest with you, it's overall self-care, but we're just going to make it very specific to the vagina, because a lot of women have vaginal pain in general, and especially with sex. Do we talk about it? No. Do the gynecologists normally know how to treat it? No. Does anybody ever give you answers? No. So you're just stuck with this pain and nobody ever actually helping you out. I'm doing good. I'm ready. I'm tired. I'm ready for the day to be over. That's how I'm doing. So anyways, let's go over a couple different things of what the heck vaginal self-care is. Let me show you my model of the pelvis. Okay, so here's my female anatomy. So this is the top of my pelvic bone. Here is this bone called, we call it the pubic bone. So on my human body, where is that area? If I stand up, it's right here. Let me back up. It's right here is the top of that bone, and then my pubic bone is right here. Okay, so that's that cute little pelvis. This pelvis is sitting right here, just to give you guys some reference points. Okay, where's the vagina? It's right here. All right, so the vagina. It's right down here. We got all these muscles on the outside. These muscles right here on the outside, especially right here at the vaginal opening, right at the bottom of the vaginal opening. This muscle, we call it your perineal body. That muscle causes women a lot of problems because all of your pelvic floor muscles, these outer ones, and the inner pelvic floor muscles, hey Emily, they all attach at this perineal body. So if we are having problems with our pelvic floor muscles, which by the way, vaginal pain does not mean your muscles are the cause of the pain. Everyone thinks it's all the pelvic floor muscles and there's all this focus on the muscles. It's not just about the muscles. And when we're talking about vaginal self-care, I will get really detailed into what the heck is actually causing your pain. Because believe it or not, it's actually the nerves that are causing the pain, and it's 100% nerve related. The muscles can be a factor in it, but it's normally actually not the cause of your pain. All right, so anyways, all these muscles are here. Here's my vagina. Now if I look at the pelvis from this side, hey Brittany, thanks for watching. You can see the inside of my body. Look what this is. This is your bladder right here. A lot of women who have vaginal pain, believe it or not, very often they have pissed off bladders. They normally, not always, but they might go pee all the time, or their bladder hurts when it's filling, or they're leaking urine on the way to the bathroom because they have urgency to go to the bathroom. Or they have they have vaginal pain and they actually feel like the bladder is coming down the opening of the vagina itself. Okay, so there's lots of different things that can happen. There's different reasons why all of this happens. In the TheHappyV program that I'm releasing, I talk about all of these things in detail so you can understand for your situation what's actually happening. Normally, all I need is women to tell me their symptoms of what's happening, and I can 100%, just from you telling me your symptoms, I can normally tell you exactly what's going on. It's just patterns that us women have over and over. Okay, so my bladder sits there. Then there's my uterus right here. Okay, so at the very lower belly area, often if you're having vaginal pain, the lower belly area can also be a factor of having pain, especially if your bladder's pissed off, because your bladder sits right there, ladies. So if my bladder sits right here, no wonder my lower belly area is bothering me. And that's why that bothers me, and that's why my vagina bothers me. It's all connected. Often when you have vaginal pain as well, we might see that you're gonna have some pain on the inside of your thighs right here, because all these muscles attach to the vaginal area. my nerves might be really pissed off as well. So now I might even have some pain in my buttocks area, on the inside of my thighs. I might get some pain all the way down my legs. People call that sciatica. Whatever you want to call it, it's all related, okay? These things are not separate. You don't have isolated leg and butt pain and isolated vagina pain. They're all together, okay? So these areas, if I also open up my pelvis here is the vagina. Here's my cervix. Here's my uterus. Okay, wedged between the vagina, here's the vagina. Here's my bladder, literally sits completely on the top wall of the vagina. Okay, the entire top wall. So if we've got bladder issues, let me tell you, you're gonna have vaginal issues. There's no way. This bladder sits way too close to the vagina to not have issues. And then the rectum's right back here. So very often, not always, but very often women who have vaginal pain, like I said, they'll have bladder issues. Very often they'll have rectal issues. Maybe they go to the bathroom all the time and they're leaking fecal matter. Hey Melissa, we will, let's talk later. After this video, you can talk to me. They also will maybe actually have a hard time, they'll have constipation, they can't get the bowel out, or they'll have IBS. The IBS is not because of the muscles down here. The IBS is often because of too much stress, too much anxiety, too much cortisol and adrenaline in the bloodstream, and often the food that we're eating. In the TheHappyV program I am releasing, I talk about all of these things, because if we do not understand the female body in a holistic standpoint, you will never address your vaginal pain. So one thing I want to make very clear, I learned this very early on in my career. Most of the time, not always, people will start to have pain. Women start to have pain. Often it will start up in the upper traps, in the neck. Their health starts to decline. They might have some stomach issues. It just depends on where it manifests. And then later on, they start to develop some bowel problems, some bladder problems, some vaginal pain. That seems to be this area, the pelvis, is kind of the area that goes not last, but this seems to be the area that happens, it trickles down after we've had a lot of other health things happening. So normally when women come to see me, they're not just having this isolated pain in that one area, for the most part. This is not always the case. So if we don't fully address the whole body, I can't address your vaginal pain. So when I say vaginal self-care, I'm not just talking about the vagina, I'm talking about the whole body. Because if we don't address the whole body, you're not gonna get rid of your vaginal pain. No medication ever is gonna get rid of your vaginal pain. It might temporarily help your vaginal pain, but it's never gonna be a cure-all. There's no one thing. Never is there one thing that's going to fix your vaginal pain. It's a matter of combining everything. So when I say vaginal self-care, I am talking about treatment that I will teach you how to do at the belly. How do I have people do that? For the vaginal program I have made, I'm not gonna be able to physically put my hands on you, unfortunately, because that's what I normally do to heal people, but I'm gonna actually send a massager that looks like this. It's got 4 little balls that rotate in both directions, and it heats up. So what you would do is you take this massager and you would put it on your belly down here. If it looks on the model, it goes right here. And you let that sit there and massage your tissues. You lay on top of it, and believe it or not, that massively calms down the nerves right in this area, which does affect your vagina and it does affect your bladder. That's how we get it externally without doing any internal work. Then I'm gonna teach you, in the program, I teach women how to do their own treatment on these outer tissues, how to use this on the inside of their legs, so we can get the inside here, how we can use it on our buttocks, different treatment techniques we can do, because all of those areas matter. I'm going to be talking about how to then use a wand. Please don't be scared by this, but this is a pelvic floor wand. Have you guys ever heard of Theracanes? I don't know if any of you guys watching have heard of Theracanes, but there's these canes that people use to release muscles in their back. This is a Theracane for your vagina. That's all it is. Why the vagina should be super important. It's more important than your triceps back here you're trying to release, right? Okay, we don't want our vagina hurt. This is simply just releasing muscles in the vagina. That's all it is, okay? I will teach you how to use this on your tissues, and I'm very extremely detailed on how that is, because otherwise you guys get scared on what you need to do. Another thing that women commonly say, they go, oh my God, can I hurt myself with this? Ladies, you cannot hurt yourself with this. Our vaginas can handle sex. A lot of the people I'm treating don't handle sex well, but we can handle a penis rushing through the vagina and not cause any damage, okay? We push an entire baby out of the vagina. This is not going to hurt you, I promise you. There's nothing you can really do to yourself with this little baby wand that's gonna cause damage to you. But I will teach you how to use this in the TheHappyV program, so that way you can start to address your own pain. If you're not using something like this and you go see a pelvic health PT like me, I'm gonna be doing this treatment with my hands, okay? So I'm just being very frank and honest on how we do these treatments. I use this little map that I created. I will teach you about what this map means and what the different numbers mean, so that way you have a visual representation of the vagina and what's happening. And that way you know exactly what you need to be doing on this map and where you need to work, because every female is different on where they're having pain. Some people only have pain at the very opening of the vagina. Some people have pain throughout. Some people only have pain at the top wall of the vagina where that bladder sits. Those women more likely are gonna have bladder issues as well. More likely are gonna have that constant frequency to urinate and the urgency. So everybody's a little bit different, but for the most part, the treatment techniques are going to be relatively similar. So in the TheHappyV program I'm releasing here in October, I'm gonna talk about all these things. So no matter what the heck your story is, no matter what's going on, I'm gonna make sure you know your own body and specifically what it is that you need to be doing for your body, because we're gonna go over all that. All right, so that's tissue work. I don't know if you guys have heard of TENS units. Anyone watching heard of a TENS unit? It looks like Melissa said, can that also cause numbness while having sex? Yeah, because that's your nerves are pissed off. The numbness you're feeling is the nerves not doing their job and not functioning appropriately. So we have to heal the nerves from the inside out. How do we do that? We do that with food. So in the program as well, we're gonna go over diet. I'm gonna teach you guys exactly what things are important to get rid of in the diet. Yeah, Melissa, you have a TENS unit. So diet, what things do we need to exclude, and then what things do we have to 100% add to our diet if we want our nervous system to heal, if we want our nervous system to calm down. A TENS unit, I'm gonna teach you how to use a TENS unit to help calm down your vaginal pain, and if you're having bladder issues, how do we calm down the bladder issues using the TENS unit. TENS units are also cheap. That massager, $25. The wand, $40. The TENS unit is $25. Okay, these things are not expensive and they're significantly cheaper than what all of you guys have probably spent on all of your other medical care that the gynecologists and urologists have done just to get you nowhere. So these are tools that are gonna help you with long-term results to actually heal your body and not just put a Band-Aid and a piece of tape over it. We're gonna talk about exercise in the TheHappyV program, because believe it or not, I can't tell you how many women I work with that over-exercise, they overperform. So they're constantly flaring their vaginal pain because of the exercises they're doing actually. So we're gonna really go dive deep into exercise and what is ideal for you specifically. The way I have the program set up, you're gonna be able to figure out where is your baseline and where do we go from where you are, because every female is gonna be different as to what it is that's happening. Nobody is ever the same. The treatment is never the same for one person. So the key is understanding all of this and figuring out what is it that my body specifically needs in order to heal. And this is what a really good pelvic health PT would sit down and do this with you. However, I go on to the painful bladder syndrome and the interstitial cystitis websites, and I talk to these women and they tell me they've had pelvic PT before, and I find out what treatment you guys have had done. It's total utter crap, which makes me so sad for my own profession. But just because you've had pelvic health PT before does not mean you've actually had the treatment that you need individually for your body to heal. So point of this video is I just wanted to explain, when I say vaginal self-care, I'm not talking about one thing. I'm talking about doing tissue work. I'm talking about using a TENS unit. I'm talking about education on diet. I'm talking about education on exercise. And the last thing is I'm gonna really dive deep into something called pain neuroscience education. And I'm gonna massively make sure that you guys understand how the body experiences pain and how we can control pain to allow our body to be in control again. Because when you're having vaginal pain, ladies, we've lost all control of our body. When we don't have control over our vaginal pain and our bladder and our bowels, we feel completely out of control of our own body and lost, and it's an area that we don't even like to talk about, and it's an area that we never get help in, and it is absolutely traumatizing. So I want to help empower you and teach you guys how to take back control over your body. And that is a lot of that pain science that we would go over as well. So all of these things coupled together, that's what I mean by vaginal self-care. I know that little phrase does not include all of this, but I'm trying to make it a phrase that is somewhat easy to understand so I don't lose people, and I can hopefully get people to understand that there's so much we can do for our bodies to heal as women. It's just, unfortunately, the medical system is not teaching us these things. But I want to teach you guys these things, and I want you guys to teach your friends these things, and I want you to teach your daughters these things, and let's help each other understand what we need to do as women to care for our bodies, because our medical system is 100% failing us all the time. So let's get out of this system. Let's empower each other. If you guys have questions about this video and all, and the program that I'm releasing, questions about me, whatever it is, just send me a message and I will be more than happy to get back to you. I normally get back to people within 12 to 24 hours. So share your story with me. Let me know your thoughts. I'm here to listen, okay? All right, night, guys. You guys have a beautiful rest of your Wednesday night.